Have you ever looked at your body and thought something feels different, but I can't explain it? Your breast hurts, you're tired, your mood is everywhere. Maybe you are cramping and you're asking yourself, is this pregnancy or is my period just about to come? If you are currently in that confusing waiting stage, especially the 2 week wait, this video is for you.
I think I found it now. What I've been looking for. Isn't it beautiful? It's got my head all up in the clouds.
Hello beautiful people, welcome back to my channel, and if this is your first time here, you're very welcome.
My name is Esther. I'm a nurse, a mom, and on this channel I break down health topics in a simple, honest, evidence-based way without fear-mongering. And in today's video we are going to talk about early signs of pregnancy, why pregnancy symptoms and premenstrual syndrome feel almost identical, how to tell the difference over time, when to test, and when you actually need to worry and when you don't have to worry. By the end of this video, my goal is not to diagnose you, not at all, but to give you clarity and peace of mind. Quick disclaimer before we continue. This video is for educational purposes only. I'm sharing general information and personal experiences, not medical advice. Every woman's body and journey are different. So please speak to your GP, midwife, or healthcare provider for personalized care. Before we talk about symptoms, we need to understand timing. When people say early pregnancy, what does that mean? They usually mean the time between ovulation and about 1 week after a missed period. So let me simplify the process for you. You ovulate. After the ovulation, the release of the egg meets with the sperm, then fertilization happens afterwards. The fertilized egg then travels to the uterus, then implantation happens in the uterus. Hormones start to rise afterwards. The key point here is that you are not technically pregnant until implantation happens. So before implantation, your body is still acting like a normal cycle, which is why early symptoms can be confusing. So now let's talk about the early signs of pregnancy. Number one on my list is missed period. One of the most obvious early signs is a missed period, especially if your cycle is regular. If your period is late, let's say 5 to 7 days, and you haven't been under unusual stress, and you haven't been ill as well, then pregnancy becomes more likely. However, stress, illness, hormonal imbalance, breastfeeding, or stopping contraception can also delay a period. So a missed period alone is not a diagnosis. Number two on my list is breast changes. This is also one of the earliest signs many women notice. You may experience breast tenderness, heaviness, swelling, darkening to the nipples, increased sensitivity. Many women say pregnancy breast pain feels different from PMS pain because it is more intense, more constant, and doesn't settle. Number three on my list is extreme fatigue. This is not normal tiredness. Many women describe early pregnancy fatigue as sudden, overwhelming, and not relieved by sleep. This happens because progesterone rises sharply, and progesterone is a very sedating hormone. That's why this occurs. Number four on my list is nausea and food aversions. Despite the name, the general name, morning sickness, nausea can happen at any time of the day, not only in the morning. And early signs include feeling sick without vomiting, suddenly hating food you used to love, or feeling nauseous from smells or a metallic taste in the mouth. Some women never vomit, they just feel constantly unsettled. And number five on my list is frequent urination. You may notice you are using the toilet more often, even before your belly grows. In early pregnancy, blood flow to the kidney increases, the bladder becomes more sensitive, and this can happen very early. Number six on my list is implantation spotting. Some women experience light spotting when the embryo implants. So the spotting is usually light, pink or brown, short-lived, and not heavy. It should not soak pads or come with severe pain. Number seven on my list is mood changes. You may feel more emotional, tearful, irritable, and overwhelmed. This is hormonal and it can start very early as well. Number eight on my list is bloating and constipation. Progesterone slows the gut. This can cause bloating, gas, constipation, feeling full quickly. Many women mistake this for PMS, bloating as well. And lastly, mild cramping. Mild cramping can happen due to implantation and uterine changes. Severe pain, one-sided pain, or pain with bleeding needs medical attention. Let's talk about why PMS feels like a pregnancy. Here's why so many women feel confused. After ovulation, progesterone rises, whether or not pregnancy occurs. So if pregnancy does not happen, then progesterone drops, then the period starts. But if pregnancy happens, progesterone stays high and pregnancy continues. That's why PMS and pregnancy symptoms overlap. So let's talk about the difference between pregnancy and PMS. Breast pain. In PMS, this settles when period starts, while in pregnancy, it worsens and it persists. Cramping in PMS increases before bleeding, while in pregnancy is mild or intermittent. Bleeding in PMS is bright red and heavier, while in pregnancy it is light and it is spotting only. Fatigue in PMS is mild as well, while in pregnancy it is extreme. Nausea in PMS is rare, while in pregnancy it is very common. Mood in PMS is predictable, while in pregnancy it is intense. Bloating in PMS settles, while in pregnancy it persists. So let's talk about implantation bleeding versus period. Implantation bleeding, it happens 6 to 12 days after ovulation, and it is light, short, pink or brown in color, while a period is heavier, bright red in color, and it lasts for a few days. Every bleeding is not implantation. I'll talk about when and how to test. For best accuracy, test after your missed period and use first morning urine and repeat in 48 to 72 hours if negative. Testing too early causes unnecessary anxiety. Let's talk about common mistakes and myths. Number one is feeling symptoms does not confirm pregnancy. Having all these symptoms does not confirm pregnancy. And implantation bleeding is rare, it's not guaranteed. It doesn't happen to everybody. A negative test early does not rule pregnancy out. If you're actively trying to conceive, I also have other videos on my channel where I talk about trying to conceive, things to put into consideration, and my infertility journey. I'll link them up here and also in the description box because this video is definitely going to help you. It's connect directly with those experiences. So please consider watching them as well. If you are trying to conceive or unsure, I want you to hear this. Your feelings are valid. Your body is not betraying you. I know waiting is hard. Waiting is hard. Be gentle with yourself, please. Let me share something very personal with you because I feel someone watching this needs to hear it. During my waiting period, I used to have a very regular cycles, which is around 26 days. Then suddenly, after I got married, my cycle started changing from 26 days. It became 31 days. The next month, 33 days, sometimes even 35 days. And every single time, I was convinced, like, this is it. Oh, I'm pregnant already when it was not coming at 26 days. And I kept doing pregnancy tests, and it was negative, negative, negative. And this is something nobody really talks about. Trying to conceive alone can change your cycle. The stress, anticipation, hyper awareness, especially during that time, all of it, they affect ovulation timing. Funny enough, when I was actually pregnant, I also knew that no, this is different from what I used to feel. I didn't rush the test though. I waited until around 5 weeks because of those delay. The 31, 33, 35 days. So I normally wait. Even with my second pregnancy, we had just started trying for what we thought would be our second baby, and boom, I started experiencing all these confusing symptoms again. And I was confused because my first pregnancy took about 8 months, and this one happened on the first try. I explained earlier that I personally used to wait until about 5 weeks before testing, and that was because of my previous experience with the delayed menstruation. So, with the second pregnancy as well, I waited because I had learned that waiting too early only increased anxiety for me. So, waiting gave me more emotional peace. So, I'll just wait. So, when I finally tested at 5 weeks, it was positive, and later I realized why the symptoms felt exaggerated in my second pregnancy because it was a twin pregnancy. So if you're comparing your journey to someone else's, please and please don't do that. Don't do that. Because even the same woman can have very different experiences with different pregnancy. The same body can have very different experiences with different pregnancies. So don't compare yourself at all. In summary, early symptoms overlap, patterns matter, and timing matters as well. If this video helped you, please like, consider subscribing, and comment. I'll be in the comment section, so let me know which symptom confused you the most. Thank you so much for watching, and I'll see you in my next video. Bye.
I think I found it now. What I've been looking for. Isn't it beautiful? It's got my head all up